1999, on 13th of February, I got married to Puneet. We were together for 8 years before that. So after a long time, suddenly on 2011, on 11th of November, he suddenly became a body, not just Puneet. And when I saw him, he had an accident. And when I saw him lying there in the mortuary, I told him only one thing, that you've gone because your work in this world is over. Mine must be still remaining. I still have something to do. So that became my mission in life. And it happened also because I believe in Sai Baba a lot. And his words of faith and patience, that whatever happens, happens for a reason. And there's a purpose. So in 2019, when my elder daughter was studying, applying for her education, that was the time when I applied for mine. And I went ahead and did join 2 masters simultaneously. I wasn't sure I would be able to do it, but cut to this day. And as I said, thanks to Janana, thanks to Amrita, who helped me study, I could, Aaron is here. Oh, wait, I have to do the management part also. But hi, Aaron.
Hi.
You missed my story, but
Oh,
it's
I'm
tough to.
sorry.
No, it's okay. It's okay. I was just sharing. You know it also. So Aaron is from Boston, and he's done an amazing work. I'll share it with you later. But it was my promise to Puneet that I have a purpose in this life. And so when my elder daughter went for education, that was the time when I started studying. It's not been easy. And moreover, it's not been a planned path, if I may say so. I just live a moment at a time because I've seen Puneet go in like this. So for me, nothing is about a long term. It's always like, what can I do today at this moment? That is what has guided me. So this today, as it would have been our 27th wedding anniversary. And I chose this day because, and I really wanted it today. And I'm so thankful to Yogesh, to Robin, Liz, Amrita, who really made it happen that we could show you or launch our website today. It's been very tough last few days, but it's been thanks to them that I'm able to honor Puneet today. I'm able to honor my parents who made me capable of what I am. I remember my mom saying a day after my father's death, I had my exam and I told mom, Mama, I can't take the exam. And I remember Mama looking at me and she said, Beta, once you start something, you must finish. And these became my guru mantra. Every time that I had a tough time, I would remember Ma saying that you can't let go, you just can't give up. And I grew up with two things that she used to say, but one I want to share here is she used to say, गिरते हैं शहसवार ही मैदान जंग में वो तिफ्र क्या गिरेगा जो घुटनों के बल चले. It means that only those people who ride on a horse will be able to achieve something. The ones who are crawling will not be able to do anything. And so today I'm here. This trust is no longer mine. Before today, the hard work of creating, registering, all that stuff was the vision. It's here. But now it's all of yours too. Because I've seen Puneet go in as if, and that's what I believe, that I can go anytime too. And that is why when we started SmileAge India, it was supposed to be about oral health for older people. Because that's my core. That's what I know the best. That's what I bring: healthy aging, health literacy, everything together according to my work and whatever I've done in the last 30 years of my life. But from today onwards, it is with Janana for healthy aging, for Pankaj for elderly care, for Raman for global health, Sheila for clear communications, everyone, Dr. Jug for dentistry, for oral health in there. I cannot do anything myself, but I've created that platform. My brother, Raj, he is an infertility expert, his wife, embryology, maternal health. My sister, Pooja, diabetes, physician. We have so many experts, diverse set of skills here. If we all come together and we focus on the preventive aspect of life, of health, of educating people how to take care. Sheila, for clear communications, she'll help us translate difficult jargon into easily understandable knowledge. So the aim is big. I've never been the as Janana had said long ago that Shala, you don't have focus. But finally, one day she was like, nah, maybe yes, it's there. It's all about promoting health, promoting dignity, promoting healthy aging. That is, that even at the end of our lives, everyone can live independently with grace, with the quality of life. I need you, all of you, and I'm so grateful that you're here with me. Amrita will talk about, I will not talk about the stuff because that's not mine, but Amrita will talk about how, what we aim to do, what is our mission, what is our goal, and Liz will walk us through the website. So thank you so much. Let's make it happen. Thank you for believing in me. Thank you for believing in me. And I hope we can make a difference. Thank you. Thanks so much. Thank you. Arushi and Arvi, nothing without you, babes. I can talk about Puneet, but it's your sacrifice that's been there. Your mother has not been the regular mother. She's not been there for you. So thank you. Yeah, I know, but yeah, thank you so much. Amrita, before I start crying, can we start with the pitch, please? Can you? It's up to you. Over to you now.
Yeah, so I'll just share my screen first. And once I start sharing, because I cannot see you all, so someone just tell me if you see the screen or not. One second. Yeah, so do you see my screen, everyone?
Yes, we see the
We see
participants.
everyone. We see all of us.
Okay. You still don't see
Now we see it now.
Yes.
We see it. Yeah. Thank you.
see the presentation, right?
Yeah.
Okay.
Yes, Amrita.
Okay. So, thank you, Shalya, firstly, for taking us through your personal journey, which has brought us all here for the first meeting of the SmileAge Initiative Trust. Hello, everyone. I'm Amrita. And over the next few minutes, I will broadly tell you or try to give you answer to two questions. What do we want to do with the SmileAge Initiative Trust, and why do we want to do it? So I love doing research and I love numbers. I'm fascinated by numbers because numbers always, I somehow they convey some meaning to me. So I will of course start with a few numbers. So in India, around 62% of the deaths happen due to non-communicable diseases or diseases which are not infectious in nature. India spends around 3.3% of its GDP on healthcare. And of this 3.3%, only 14% is spent for preventive health. Rest is used or allocated for reactive health. So what does this tell us? These numbers fundamentally tell us that the fight against chronic diseases in India is mostly being fought at the crisis management stage and not at the preventive stage. So that went on, that became a question for us at SmileAge Mission, that can we reimagine or rethink the way prevention is thought about in India? Now, one of the best methods which has been used even in history for prevention, health prevention, is health literacy. But I know that most of us here and in general in the community, when we say health literacy, we think that it is about distributing pamphlets, or information about a particular health condition, or it is about conducting these one-time awareness talks about health issue, or in today's society, it might be about, the forwards that you get on WhatsApp or on your social media platforms. However, health literacy is actually much more than that. Health literacy is the ability of a person to understand health risks. It is the ability of a person to navigate through the health systems. It is the ability of a person to make informed decisions about healthcare repeatedly over time. And this idea that health literacy is a powerful weapon was even further strengthened in our minds when we looked at the Health Inclusivity Index, which was published in 2025. So for India, they said that a person who has low health literacy spends about 3 times more the money on healthcare costs as compared to someone who has a higher health literacy. And that's a huge difference. Another concept which we also thought which is useful in telling people why health literacy is important is if you think of health literacy as a social vaccine. Now, we all know what a vaccine does, right? A vaccine works by preparing the immune system before the disease strikes. Well, a social vaccine also does something very similar. It works by preparing individuals and communities before there is any harm caused by misinformation or neglect or delayed care. So we decided that we would like to see health literacy function like a social vaccine. And why is it so? Because health literacy can help build resistance against misinformation that is spread in the community. It can reduce dependence on crisis-driven healthcare. And health literacy is not a static entity. It is a dynamic entity, meaning that it can increase and compound over a lifetime. So we start with a very basic system at SmileAge Initiative Trust. We think that health literacy as a mode of prevention actually acts like a social vaccine. And we want to build this system further uh, based on evidence that we gather from the community, programs that are rooted in the community, and that are ethically grounded. So for the trust and its activities, we have thought of 3 work pillars, and we call them our aura. That is outreach, research, and advocacy. So the first pillar is outreach. So in outreach, we intend to conduct several outreach camps, and this will be spread across all age groups and communities with a special focus on underserved communities. The focus of these camps would be mutual dialogue and not just a one-sided or a one-way transmission of information from us to people. And the feedback that we collect from this outreach will be used in the research and the advocacy divisions. The second pillar is research, where we intend to generate good quality, credible data by doing field work. We also aim to address context-specific barriers. So what I mean by that is we do not want to have a one-size-fits-all approach. We see what is the need of the community that we are working at, and then we design the health literacy module as per the need of that specific community. Our third pillar is advocacy, where our aim would be to translate all the evidence that we gather from outreach and research into policy relevant language. We also intend to engage with the stakeholders, not by playing a blame game, but we want to convey to them that we are on the same side of the table as they are. Another important work that we want to do with advocacy is to correct the existing misinformation ecosystems that are present in the community. So with this in mind, we have, as of now, we have conceived 2 projects for the trust. The first one is called SmileAge India, Oral Health for All. Why did we think this is important, apart from the fact that Shalya is passionate about oral health? But not just that, but also because we saw that oral health is still very poorly understood. So how can health literacy fill in that gap? Because most oral conditions are preventable, and there can be an early
Your
understanding of
voice
these
is
preventable
cracking up.
causes that can you hear me now?
Yeah, much better. It was cracking
Okay.
up in the middle.
Sorry. So we think that through health literacy, there can be an early understanding of these preventable conditions that can lead to a sustained behavior change, and that will help reduce the problems or the cost of healthcare for these conditions. So what do we intend to do here? Again, there would be a need-based assessment done in screening camps, and that will be followed by tailor-made literacy programs in the community. The aim is very simple here. We want to integrate oral health into every care routines. The second program that we have come up with is called AXESAR 71, and it is about gender neutral HPV vaccination. So cervical cancer is the second most common cancer which afflicts Indian women. And most of the times, the cause of cervical cancer is this virus, a human papilloma virus, or the HPV, which means that if HPV infection can be contained or can be prevented, then cervical cancer is very much preventable. Okay, so there is a vaccination for HPV. Then why is cervical cancer still so common in India? That is because the vaccine coverage is much lower in India as compared to the developed countries. And that is where we see a gap in health literacy or information about the condition. So why is it important? It is important because HPV not just prevents cervical cancer in women, but it also, the vaccination for HPV also prevents 6 other different types of cancers in both men and women. So it's basically one vaccination and there can be prevention against 7 different kinds of cancers. Also, health literacy is important here because vaccination decisions are deeply social and culturally rooted. So what we intend to do here, we want to drive awareness campaigns and integrate the discussions about HPV into the public discourse. And secondly, we also want to generate credible data towards advocating the inclusion of gender neutral HPV vaccination in the universal immunization program in India. So we have already started taking small steps in both the projects. Like in October 2025, Shalya and Manjari from our team conducted an oral health awareness checkup and research camp in Vidisha, Madhya Pradesh. Also last year in January, there was the first national summit on elimination of cervical cancer in India, which was held at AIMS, New Delhi, where Nyamat and Manchi from our team, they pitched the cervical cancer program that we have thought of, and they won the second prize in the innovation challenge there. So we have started taking small steps. So I would finally like to conclude by saying that at SmileAge India Initiative, we are building, at SmileAge Initiative Trust, we are building health literacy as a necessary infrastructure, which is important for the well-being of the community. And at this stage, all we ask from all of you is to help us form an alliance if you think that prevention is not passive, if you think that education is not optional. So thank you for your patience. And now I will hand over to Elizabeth, who will be taking you through the website. Thank you again.
I'm excited to see it actually there.
Thank
Such
you,
a beautiful
Amrita.
thing. Thank you so much.
Yes, so let me just share my screen. Just give me a second.
Raman, you want to say something?
No, Shalya, sorry, it's I think by mistake. I hold on.
Okay, so yes, so just want to say that today has been a very meaningful moment for us. And we're very proud to kind of officially launch our website, which is still in work in progress mode, because obviously we did a lot of work behind it to get the right kind of information. And this is a platform that reflects who we are and what we stand for and the journey we are on together. It's also designed to make information more clear, engagement easier, and our impact more visible as we strengthen our connection with not just the community, but even the stakeholders. And of course, it's a result of shared commitment and collective trust. And we are deeply grateful for everyone who believed in us and contributed to this vision. And with pride and gratitude, I'm happy to share that our website is now officially live. And I would just like to take a few minutes to walk you through it and invite you to explore the space that we have created together. So this is what the homepage or landing page would look like, talking about healthy aging through health literacy, one smile at a time. What this talks about is SmileAge Initiative Trust and what we are doing. Then we have our mission and our vision, which Dr. Shalya and Amrita very briefly explained. This is our core values that we are working on: social equity, multidisciplinary care, inclusion, lifelong prevention, evidence-based practice. So SMILE is what we are working on. Our work basically talks about outreach, research, and advocacy for healthier futures. And the three pillars that we are working on: evidence and innovation, implementation and program. These are the two projects that we're doing: advocacy and capacity building. There are ways that you can get involved with us, which is either through resources, Knowledge Hub, Learn, or you can partner with us. Basically, it talks about all of that. I'll just take you to what our diverse team looks like. So we have a distinguished panel of national and international advisors who are guiding us with our work. So we mentioned about them. So this is our team, and I think Dr. Shalya would introduce each one individually. I will just run it through. All your LinkedIn profiles are already linked here. If you're going to know more, it basically opens a little pop-up about what you are doing professionally. So that is something that we would like to know more about, like some fun facts about you. So if I have to see anyone for that matter. So this is how it opens. Yes. So and then we have the founder's message, Dr. Shalya in her professional look.
Very tough one for me.
We have the message. And then the other places, we are still working on it. So we've just put our work here, the pillars of impact that we're working on currently. And there are more pages which are like work in progress, and they should be up within 1 or 2 days. Then we also have the SmileAge India program, which is building oral health for life. This was something that Dr. Shalya had started doing already. And so that's also here. Then, of course, there's get involved and contact and everything else. Yes. Thank you. Dr. Shalya,
Alice,
over
if
to
you can,
you.
thank you so much, my dear. If you can stay at the team and yeah, the pictures. Thank you. Raman, you are excellent at this. Would you please take over for this part? Introducing people. I can, but I will just say personal stories. So I will add the personal story, but if you could take over the official introduction part, please.
Thank you, Shalya, but I think you're giving me a very difficult space to hold, and especially meeting everyone for the first time, and also having to meet you a few months ago, all online, and learning the passion that probably connects us. And there are, I'm sure, other reasons that, when we say we don't meet people in person forever, there are certain things that are kind of making us connecting at a spiritual level or a universal level, that at one point we will gather. And I think that's our story. And I'll say while we've been talking here and Shalya was sharing, I just tried to look at how I understood that, SmileAge initiative would have its team working and how we are looking at people will be described. So what I'm planning or what I may say is, let's say if we do some fun stuff that, and I'm sorry, I'll urge some of you to switch on your cameras and others to switch off. So probably the way this website, and I think it will be organized and reorganized depending upon how we see. We have our trustees, which are you, the board of directors, or the family foundation that we will, and some of your friends. So I'm just thinking if we can have all of you hold your screens and we see you on there, and Shalya, probably you can then take over if you want to say, and I can say a couple of words, maybe bring people on so that we can have everyone as we see. So maybe Shalya, you're of course you, Arushi, Arvi, Professor Dr. Raj Kaval, and Reena Rao. I think you guys are present for our meeting today. So if you keeps your cameras on and everyone else can take the camera off, so we just recognize you there. And if there's something collectively the trustees would like to share together to us, who are collecting here for you, it will be a nice moment if we take that couple of minutes. So please, all of our trustees, please have your cameras on, and everyone else, we can go off camera for a while. Here you go, Shalya.
Thank you.
The floor is yours again.
Thank you so much, Raman. So for me to start this trust has been a very, very big and an interesting job. I didn't want to, but now we have a platform and it's for everyone. And for me, my trust first has to include my Arushi, RV, and Raj. So I would like to introduce them. Arushi, would you like to introduce yourself first? Arushi's gone. I should have started with Raj because Umar ke hisab se Raj comes next. Okay, Raj, would you like to introduce yourself? Say
I would
something
like
what you
you to
feel about
introduce
it.
myself because, yeah,
Yeah, something about yourself, what you feel.
it's a great initiative. I'm very grateful to be part of it, and I'm practicing all the cancers part and everything here. And when you started it, I was really happy. I would be able to be part of it and help the dream which you are nurturing now. And I'm really happy to be a part of that. Thank you. Thank you for making me the part of it.
Thank you. Arushi, RV?
Hi, am I audible now?
Yeah.
Yeah. Hi. I think I would say I have seen my mom in oral healthcare for all my life. I'm turning 25 this month. I've seen her practice 25 years at least. And she's practiced. So yeah, I think this is definitely her baby. And she has worked so hard. I question how hard I can work because she works harder than me. It does give me a lot of courage, definitely, especially for somebody who changed the trajectory of their life at the age where people are not flexible enough to.
We don't hear you, Beta. Your voice is stuck. We don't hear you. You're in a place. It's okay. RV can carry on.
Can you hear me now? Can you hear me now?
Yeah, we can hear you now. Yeah.
Yeah, I'm just saying you have genuinely. I'm sorry, I'm outside. I'm just saying you have genuinely. I've seen you work really hard. I am incredibly proud of you.
It's okay. It's not about me. It's about the trust.
Trust-wise, I am very excited for where this can go, especially for the domain I work in, because I work in social media. And I believe today that social media genuinely changes everything because it is what is omnipresent, and especially for my generation that doesn't even look at news generally for their daily news. A lot of us are impacted by what is found on the internet. And I don't think oral health literacy is something that is prevalent on social media. So we might be the first ones doing it.
Let's do that. RV?
Well, just to start, what my sister was saying, I completely agree with that. Just the fact that, growing up, first of all, can you guys hear me? Is everything?
Yeah.
Okay, perfect. Yeah, just the fact that I've also grown up like seeing my mom work in oral care, like from the beginning, and her task and want in life has always been to help people out. So it's so beautiful to like be here sitting with like, yeah, 20 people and so many more that weren't able to be here right now, but that are believing in her and her dream and adding on to it. It's not just her dream anymore. It has become other people's dream. And I think that's such a beautiful thing. So I'm very proud of her, and I'm very grateful that I can be a part of it and support and help in any way I can. Personally, I am in university right now, actually also literally. What I hope to be able to contribute in this area is to help a little bit more with research, because I do psychology. So that would be something that I would really like to be help out with, and just outreach, and hopefully with the websites. But I'm just happy to be here. Yeah.
Thank you, Vita. Thank you so much. Thank you. Yeah, that's it. Prashant is not here. He's still working. So, Raman, we go to the next one. Our senior advisors.
Yeah, I think that's a board, or let's say the way division has been done for us, or probably not a division, but diversification, I may say. And that's how Shalya has thought of us. So in senior membership for the board, as we say, the board, this one is more like overseeing the work and welcoming you all. So again, I will say the names, and if everyone listening your name can keep your cameras on, and rest if everybody goes camera off. So it's Yanana, you, myself, Dr. Rajiv, and Dr. Jan, 4 of us. And yeah, if we can hold the space for a while. And Shalya, if you want to go in the number,
Sure.
who you want to talk first.
I would start with Janana, because she's the one where I started in 2020 with. So Janana, please, I have been waiting for your quote for a long time for my website, but now let's have it here. And thank you for taking our time. I know how busy you are.
Thank you very much, Shania. And as a teacher, I live for the days when I see my students as former students as colleagues and friends, and that we can move forward issues that we are passionate about. And for Shalia, there is no lack of passion for oral health. And we met in the program of Healthy Aging, and issue of integration of oral health into health care of older people is not only neglected in India, it's a global problem. So while we are focusing here on working together in India, I believe that there is a world waiting for us to continue this very important work. So thank you, Shalia, for including me with this wonderful group of passionate practitioners from all sectors. And in any way we will work together to improve oral health and health literacy in India, and I would like to add, and beyond. So congratulations on this very important day.
Thank you so much. Thank you so much. Dr. Chug, please, if you would say a few words.
You want me to speak, Shalia?
Yes, Dr. Chug, yes.
Okay, I'm Rajiv Chog. First of all, I must thank Shalia for making me a part of this wonderful initiative. I have been working closely with many organizations in dentistry. Primarily, I've been doing clinical work myself, but in the last 3-4 years, I've been working with as president of Indian Dental Association and chairman of the Perifoscial Academy in India and other organizations. So I developed a lot of interest in public health and community health dentistry, because I kind of found that there a lot needed to be done in this field, especially in India. It's required all over, but in India especially. And I had met Shalia many years back in the International College of Dentists, and then we lost track, and then we came across each other on the LinkedIn, and I saw her activities, and that really influenced me. And I think from there on, we have been in conversation. And when she started this project, this initiative, and she approached me, I grabbed the opportunity, I would say, because I wanted to be a part of some public health, community health programs, which is definitely required. And I think there couldn't be a better platform than what she has created, and all of you being a part of that. I would love to be contributing to this, whichever manner I can contribute. And my best wishes to Shalia and to the rest of the team. And we look forward to working in very close proximity to improve the health conditions. Specifically, right now, we are working on India, but I think globally also there's a concern. Thank you so much, Shalia, for inviting me in this.
Thank you. Thank you. It's my pleasure to have you here. I don't see Jan Hendricks. Raman, you are on my side of the table. So you are senior, but we talk a bit later. Can I have Jan Hendricks? Jan? Jan Hendricks is an amazing friend and my support system when everything goes up. He's gone out. He's not here. Okay.
Shall we go next?
Yeah. Can I have Reen? Yeah. Please go ahead, Raman. I would like to hear you, please.
I think thanks to Janana, Dr. Rajiv, and I think the passion or the reasons that we are connecting, it's connecting different ways. And probably when I get to say it will be something that we can collate together, and I'm waiting for that moment. So before that, I would like to now bring forward our other members. Mr. Pankaj Mehrotra, you are here. Pooja Rilia, you are here, and Marilyn Christie are also present. Can you guys have your cameras on now so that Shalia and we can get to hear you and we get to see you a bit more clearly when everyone's with their cameras off, please. And Pankaj, Pooja, and Marilyn. Yes.
Pankaj, can you say a few words, please?
Okay. Can you see me on the screen?
Yes, we can. Yes,
okay, great. Okay. Okay. My name is Pankaj Mehrotra. I'm based in Delhi, India, and I've been involved with the aged care sector, the elderly care sector, for the past 21 years now. And during the past couple of months, I connected with Shalia and got to know what she's doing. And it was actually a kind of a synergy, and in a seconds we clicked together to come to a common vision as to what can be done for the country. Because I strongly believe that in a country like India, you can't expect everything to be done by the government. We have to do our part also. And I think this particular platform with 20 of us sitting together, and I genuinely believe that if we all can't do it, then I really wonder in India who will do it. Because a lot of people don't have the voice, and we have to be their torchbearers to raise their voice. It's not only about Delhi, Mumbai, or Kolkata. It's at the bottom of the pyramid that the entire impact will go through. And I'm sure with SmileAge Trust and everyone involved, it's going to make a lot of difference in the coming months.
Thank you so much. Thank you so much, Pankaj. Pankaj was the one who took my interview for the elderly care. And when he asked me for the interview, and finally when I came on YouTube, it was a very embarrassing because I think I look pathetic and I wasn't even prepared. But he brought out a very important part. And that's my passion. Janana knows that. That's what we are going to work for, oral health for older people too. But right now, it's even more broader than just one team. Can I ask Pooja to say something, please?
Good evening, everyone. As I mentioned earlier, I'm also practicing in Delhi, And I find this very interesting and unique in the sense, like as a practicing physician, you see one end of the spectrum when you're treating patients. So to be able to use that knowledge to get to the preventive aspect is great, because as mentioned by everyone, that we do have the knowledge, but we are not able to use it to our patients' benefits, so as to be preventive rather than curative. So hope to bridge that gap. And again, thank you to Shalya to start this so that, we can work on this. Yeah.
Thanks. Thank you so much, Pooja. Merlin, would you like to say something?
Yes, of course. Hi, good evening, everybody. First of all, I'm really very happy to be the part of your initiative. I know Shalya Di, I call her Di, of course. Like, you're very passionate. This is your dream project. I'm very glad that I'm being the part of this. Now, well, I'm being I'm also an academician and clinical practicing embryology. Being in the part of assisted reproductive technology, we have seen HPV virus affecting cervical cancer. We have worked on that. We have diagnosed that, colposcopy, everything we have done. But now I'm very much happy to be a part of this initiative because HPV, as it leads to oral cancer. So, like for me, it will be another dimension, another area of expertise where I have to work with you. I would love to work in that. And yes, it will be a great learning for me also, other than ART, what we do. So I'm glad at last our website has been launched. I'm very happy for you, Dee. And I wish all the best for this, for future.
Thanks. Thank you so much, Petra. Thank you so much. I would like to call Reena because she's one of my senior people. Reena, are you still here?
Yes.
Yeah, Jan Hendrik had to, because his website Wi-Fi issue, he's having some Wi-Fi issue. He'll join. Yes, Reena, please. We don't hear you. You're mute. No, Reena, mute. Reena.
Can you hear me now?
Yes.
Can you hear me now? I think it's
yeah, I can hear.
Can you hear me?
No. Yeah,
yes,
I can.
Yes.
So first of all, Shally, I would like to thank you for making me part of your Smile India. And the reason, SmileAge, I would say the reason why I'm so passionate about it, because since I have been dealing with clients who are from rural background and I see they are lacking so much of oral hygiene, and it's a very good initiative. And especially for Indian conditions, I think it is going to take you miles ahead here, because this is one of the requirement, I would say, basic requirement which we need, the awareness which should be given to people not only in rural but even in urban area. And I'm really very happy for you. And this initiative is really going to take you far away. A good purpose, a very good initiative, and I'm very happy about it. And I am surely going to protect you from all the legal angles, whatever.
Thank you.
Thank you. Because your purpose is
Yeah.
very, very noble, I would say. That's something very great about it. And I really loved it. And I'm very happy to be part of your SmileAge.
Thank you so much, Reena. Thank you so much. Actually, I know Indian context only. I've worked there for 50. I've been there for 50 years. Papa, mommy, doctors. They both were doctors. So I know the system. And for me, all this education was meant to be brought back to where it really matters. And I've always said this, that there are just 4 things that you need to do: brush, floss, rinse your mouth, not eat sweet stuff. It's very simple, and go to a dentist every 6 months. And still there are 3.7 billion people out there with oral diseases. So there's something that we are doing wrong. There's something that we need to do differently. So maybe if we empower people with knowledge, they make it their own responsibility also to take care. So thank you for being here. Raman?
Yeah. Can we do quick so that people are not finding it that
sorry,
next we are not quick in the sense in the quick, like now we have our executive management team, people who will actually do the work behind, and some of us you've spoken so far, I mean all of you, they are the contributors, but I think we need a trail of very initiated and bright minds. So can I have Amruta Tripathi, Shaila Khwaja, Elizabeth Ike and Niamat Bindra, you are part of this management team who are present right now. Please have your cameras on so that we can hear something and get to see you together. And yeah, hopefully small introductions.
And Elizabeth.
Please.
And Elizabeth, yes.
Elizabeth?
And Sheila, yeah, Raman, it's Sheila.
Is Sheila here?
Sheila calls. Yeah, no, this is Sheila. Yes, Sheila, would you first like to introduce yourself?
Sorry, Sheila.
Okay. Can you hear me? Okay. So, first of all, I'm very honored and I feel very Indian right now. I do have Indian roots, but they're hidden behind this very pale skin. So it's my personality, which is very Indian. I'm honored because I can see that there is a lot of work to do. And you mentioned where we did something wrong. Well, the advocacy doesn't start at the adult age. It has to start in the schools. So this is the first part we will also need to be to focus on. And that's the earliest stage you can start. Having said that, there is so much I'm going to learn, and especially considering the size of the country. And I'm excited and I'm happy to have a team with me because it's teamwork, not individual work. And Shalia, thank you so much. I will never stop thanking you for inviting me. And I'm going to keep your dream alive.
Thank you. Thank you so much. Amrita, would you like to say something?
So yeah, again, hi everyone. I think my reason for helping or trying to join this initiative, apart from the fact that it was Shalia's thing, so of course I had to be there. But upon that, I think what kind of drew me to this is I have been academia for quite some time now, and I see the gap between, research when it's done and then when the difference between the research done and then translating it into action. And for me, that's when we do something, when we find some research or when we find something interesting, and if we are not, kind of using it in the society, that gap is sad for me. And for me, my
Your
provided me that action and can you hear me now?
Yeah, your internet vibe, something.
Yeah.
Yeah, Nabi,
yeah. I'm sorry. Okay. So yeah. So for me, that was the main reason for joining here. That I wanted to be a part of a team where research is not just done for publishing papers and gathering H-index, but it is also done to translate that result into the community and to see if it works in the community or not. So glad to be a part of it, and hopefully we will do good.
Thank you. Thank you for being here. Niamat, would you like to say something? And I would also like you to share a bit about what you did.
Thank you so much. So I'm a family friend, and so it's both thing, family and friend. So that holds a very special place. I've been in this sector for almost 20 years now, and I have worked in the field. Primarily, I come with a lot of experience of research and field work. And when Dr. Shalia spoke to me about this, I said she's just talking straight through to my heart, because this is a space that I have seen there is a lacuna, there is a vacuum. And when I spoke to her, the passion, of course, all of us have that. And I'm also seeing one or two familiar faces in the group as well. So it's nice to come back to people who you look up to. So for me, the reason is the lacuna, the fact that I believe that this is a gap that needs to be addressed, and of course the learning that goes with it. And like Dr. Shalya said, it marries everything together: community, implementation. So I really resonate with that, and I think that is going to make the impact. And like what Pankaj sir said, if we can't do it, who will? So we're there, your team, we're there, we're in front of you, Dr. Shalya, we're behind all of you. We're going to make this happen, and it's not only not your dream, it's our dream also. So thank you for
so
that.
much. Thank you.
The experience speaking in AIMS. Now, for those who don't know, it's one of the biggest and the oldest civil hospital, highly respected in India. So that was a really big honor. And sharing the work that we do and what we have, what we want to do actually was a great thrill and a lot of respect, and young women coming forward. So Dr. Manjari and I were there. So they were very happy to see women coming forward and talking about this very openly and sharing what we really want to do. And I think what we've discussed in this space is very tangible, it's very doable. So very excited to be on board, very excited to show everybody and make that change. So even if we make a difference in one person's life, I think it's amazing. And I'm sure with all of us together, it's only going to be more and more lives that we'll help and work in the community. So I'm just dying for the work to start. And yeah,
I'm
so
coming.
thank you
I'm
so
coming,
much.
and we start then. Thank you, Elizabeth. Liz, would you like to say a few words?
Yes, thank you, Dr. Shalya. So first of all, I am very, very new to medical content. So the kind of work that Dr. Shalya is doing is, of course, new for me. I'm not from the medical field. My backgrounds are in communication and events. But Dr. Puneet and Shalya have always been part of my life. I think right from the time I passed my school, which is, I think, year 2003. And they were family. I've seen the kids grow up, like the same way, like how Shalya has seen me grow into what I am today. So standing here along with them, working with Dr. Shalya is actually very grounding and it's very difficult to put into words like why I'm here. But then it feels like coming full circle. And I'm very, very proud to be part of this team and also to work with the team. I am going to be there and also very happy and proud to share this moment with all of you. Thank you.
Thank you so much. Just for everyone's information, so I have these are my leaders of the heads of my teams. Amrita would be leading the research. Niyamat is leading the outreach programs when I'm in India, and Liz, if I may say so, leads me, heads me too, because she manages everything else for me. Yogesh is the head of marketing, but he has been traveling to Nainital. So I think he couldn't join, but without him, the website wouldn't have been there. So I want to thank him. There's someone else who's here. I think he had joined Mithilesh. Without Mithilesh, all this wouldn't have been possible because he's taken over all the work about the accounts, the IT, everything over like I'm so relieved that he's around. He's got me those ATG certificates and 12A certificates because I'm not good at all that part. And he just makes it super duper easy for me. So thank you, Mithilesh, if you're here. Mithilesh, he had joined. I don't know whether he's here now.
He's here.
He's here.
Yeah, I am here.
Mithilesh?
I am here. Yeah,
Yeah.
I am here.
Yeah. Thank you so much. Thank you for attending.
Thank you. Welcome.
Would you like to say something? Which can I?
So, actually, it was your dream, ma'am, and I know that from the long time you are chasing your dream, and you have tried so very hard for the all the compliance person, because the compliance for the person who are residing outside India, it is very difficult to comply all the things. And I know how you are so passionate to your dream to incorporate the trust. Then you are chasing the all the registrars and for the to get it registered, then get the PAN card, then to open the bank account. It was salute to you for such a general cause. You have you have dedicated so much efforts. So and I congratulate for such kind of milestones we have achieved, especially for the websites and the supports which I am seeing over the conference right there, which is incredible. And it's a very congratulations for the such kind of milestone. Thank you.
Thank you so much. But as you know, so Mithilesh has seen my funds go down because he manages my personal funds also. Like he's always been he was with my father. They used to manage my accounts, and he's seen the whole dip going down from what I had to what it is now. But he's also seen me, I think, today finally understanding how rich I have become with what I have now. So finally, beyond money, tangible, countable money, but with all the people who are around me, I think I'm much richer than ever before. So I'm so glad you get to see that today. Thank you. And now
Perfect.
yeah. Yes, Raman. Thank you.
I think we have our, the way you are labeling us so that we also know how much we need to contribute to the way we need to. We have our program operations volunteers. So we have Dr. Arun, Vasundhara Puri, and Tanisha Gandhi. They have also joined. So probably you guys want to bring your cameras on.
Vasu, you can't leave right now. You have to drop, but you have to come and show us a face. Vasundhara just sent me a message saying that she has to drop. Aaron is here, so Aaron is going to say a few words. Aaron, hi.
And
Tanisha is also.
Tanisha, if you can also go just camera, like at least let's see your face.
Yeah,
Thank
there
you.
is my girl. Aaron, would you like to say a few words?
I'm really sorry, I'm a little bit sick.
Yeah, can you hear me? I'm not sure
Yeah, we can hear you.
Okay. Well, I have a background in research, and I'm going to be helping out with the research and partnerships here. And it's been a real pleasure to work with Shalia and other members of the team. I think promoting dental health quality and literacy in older adults is just a wonderful way of honoring their dignity and improving their health and helping them live with greater comfort and confidence. I think these days it's not easy trying to make a difference in this world, but I think this project has a real chance to do that, and it's a real privilege to be part of this team working together to be making a real difference in the lives of older adults.
Thank you so much, Aaron. Thank you so much. Tanisha, would you like to say something? Tanisha?
Hi, everyone. Thank you. So I would be working on the analytical part for all the donors that we would be having, the partners that we would be having, the partnerships we would be having. So I would be helping with the analysis to make the visualizations, which would be very easy for people who are not from tech. And it would be a lot of self-explanatory for everyone who would be going through them. And they can understand what the bar graphs or what the pie charts would be showing. And it would be easily understandable for all the internal as well as the external stakeholders and all the people who would be watching the analysis.
Thank you so much, really. And so your work part will start once we get some funds. Right now, it's a party time. But thank you so much for attending, even though you're sick, and you've been a big mental support. I still remember you telling me you can do it, even though we met within 10 minutes. You were like so confident that, yeah, Shalya, you can do that. So thank you so much. Thank you so much for everyone for being here. I feel so humbled because I've met all of you individually, and it's the first time that everyone comes together. Raman?
Is it my turn?
Yes, sir.
Okay,
Finally, yours.
Yeah, thanks. No, maybe everyone can have their cameras on now because it was just my way of making us to know how things will be and how we can relate to ourselves. It's a beautiful space that Shalya has created. And I can just say a couple of words or maybe a couple of minutes. It was April 24, 2025. I was in New Delhi. I attended the World Health Summit. And being an Indian who's out of India for last 20 years. I live in Umeå, Sweden, which is, I think, near North Pole, which is Arctic Circle, where today it was minus 25 degrees when I left home. So that's the kind of cold and darkness I've been living in. So when I went to Delhi last year and I attended this World Health Summit, I stood there and I felt I was a foreigner in my own country. I didn't feel a part of that space in terms of health. I did not feel that I belong here anymore because I haven't done much of work with India, though my heart beats. I think everyone has. Sheila, you said you've become somewhat Indian because of your background. And interestingly, I come back on 27th, I arrive Sweden, and 28th April on my LinkedIn, I have a message from Shalya. Would you have time to talk to me? And I'm like, okay, what kind of universal ripple or trickle is that? I become curious. I see what she's doing. I'm like, okay. And this is how we met, because when I left Bharat Mandapam, I think Dr. Rajiv would you know very well. And I felt, what is it? 20 years later, whereas my dream of where I am, it started from standing outside a hospital because I have a personal loss for some reasons, and I'm thinking, how can we improve the health literacy? When will my oral health, we start to think these little things that make a big difference. So my background is I am also a dentist, trained and clinically very active in India for first 7 years, then moved to London, moved to Sweden, and I'm a 100% hardcore dental public health specialist. My heart burns for prevention. My heart burns for inclusion. And I'll end by saying today I finished a course that I do at Omeo University in my master's program. And I handle this course, which is called Leading Change and Development in Public Health Practice. And I would like to read something that I felt will make sense here, because inclusion for change drives me. And that's what I said. April 24 and April 28 resonates with me, Shalya, and I'm just there. So change, I'll grab an opportunity. As you know, India, I don't want to be a stranger there. I want to speak my language. I'm tired of sometimes speaking only English and only Swedish. So थोड़ी हिंदी बोलने का, पंजाबी बोलने का मन करता है. It does something to your mouth when you speak your own mother tongue. And I want to say maybe this space, because we have, this is an adaptive challenge. There is no technical fix. So we all require learning, and learning will require experiments. Running these experiments, we would need to see different options, all of us. And probably it's hard to see the option when we are just stuck in one role. So I think this room redefines that we need to take courage and come out of our comfort zones. And also maybe we are creating a space together where the work of us, developing all of us as people, where we can create space where we can actually be honest about ourselves and say, maybe I don't know that. Even I need to learn. So I think this is the little Arvi and Arushi, your mom. Yes, she's burnt for what she's done. But I think some of us who have been, navigating this space, and I say to her, dental public health and prevention is all I understand. Clinical dentist, I'm a dry dentist. So looking forward to be, supporting this as much as possible. And Shalya, thank you for having me on board.
Thank you.
Back to you. I think we can start to think what we want to do next. That's for you to tell us, and we will be happily around with you.
Thank you so much, Raman. Thank you so much. It's such an honor to have all of you and call you my friends. To have today, I may see you on the screen, but I feel that we are all on the same side of the table, looking at the problem together. And problem is not one. I don't want to do, there has always been a divide between oral health has been different. My father was a surgeon, my mom's gynecologist. My father-in-law, Papa, was a pediatrician, Pooja is a physician. So my brother is an infertilologist. So we have had the plethora of all different diverse fields in the house. But why do we have oral health separate and the general health separate? For me, I've always told my patients ki ghar ko kitna bhi sundar, like you may clean your house as much as you want, but if there is some shit lying outside the door, it's going to walk in, it's going to just destroy everything. So oral health, Pankaj, if you remember, I spoke only about oral health for older people. Janana also knows me for that, because in my entire 2 years of master, that's all that I spoke about. Oral health in every assignment in different diverse fields. But we have lots to do. And that is why we've tried, not I, but we have tried, Amrita and me, because Amrita is leading my research. Our aim is not to do just outreach camps, go there, do some checkups, show our picture, put our trust on the web media and say, hey, we're doing a lot of things. No, but we want to go in a very structured format that wherever we do go for our outreach, we also do some kind of research with it. I would like to share today that I there's we already have permission from 2 validated tools to do research in India. The only thing that we lack is funding because I'm not very good at that part. But we have entire ideas, projects, people who can make a difference because our work would be pillared under 3 things, that is outreach, research, and advocacy. So in every outreach camp, we would also like to do some research, get some data. We have excellent people like Amu, I know, is like excellent with her research concepts, and we have so many of us. So through those same project, I'm also a health economist, by the way. That's one of my masters I did. So I've learned to optimize resources. And for me, optimizing, and Amrita is also one of my health economists, and she knows more about economic modeling. I know the concepts of bridging the different worlds together. So the aim is to be able to bring out certain evidence through our work so that over a period of time, we are also able to influence policies. Work which is not done per day and it's over. No, we want to do something. Ek ek boon se, my mom used to say, it's a general line. Every drop counts. And that is what we do want to do, that every advocacy that we do, every outreach that we do, we create such path that can be reframed later. So what I would want from you is to think and come up with yourself. I can't ask you that, okay, please give me that, because I'm the person who gets clarity by action. Honestly, I'll be the first one who says that I don't know anything. I'm still learning. So I want all of you to say what you can share, what you can do to take this cause forward, because I'll say it again, it is our trust. It's not mine. I'm prepared to die at any moment. My kids know that very well. I've told them since a long time. To be prepared, we can all go at, and if I go at this moment, I want all of you to know that I go happy. I go complete, I go satisfied, because it's been a meaningful life. And that's how I want to live every moment of my day. So please, it's up to you. I would like to ask you, how would you like to contribute? How would you think we should take it forward? Regarding the website, we have 2 pages ready. Those boys worked. Yogesh is not here. I think he couldn't join in, but I would like to thank him, Robin, Rajendra, all these people. And this is our website. Elizabeth has just shared it on the chat. It's like we to be very make it interesting. I had bought the domain SmileAge India earlier, and then we changed because the trust name could not have India. So I bought a new domain now, and now it's called SmileAgeInitiativeTrust.com. Thank you, Liz. So please be very critical, be very open. Help me. I'm coming to India for 2.5 months. I want to do a lot of outreach camps. Help us find places where we can do it. Fill in the gaps where I lack. I'm ready to do the hard work. That's something which I know how to do. So thank you so much again for being here. I'm really, really grateful to you. Thank you. And I've now
Can I request everyone to have their cameras on so we can have at least one screenshot? Probably that will be a good way to just have a memory of the day today. Yeah. So I think if everyone takes a moment, please put your cameras on and we can have a screenshot. Yeah. You know, I've been doing this with my students. We've been having some fun, and it brings so much of joy in the end, which we don't necessarily, we underestimate these moments. So, yeah, Matya, Arun, would you like to
screenshot?
Yes, I can take, or maybe I mean, whoever wants, we all can do, but I'll do so that.
Arush is missing. Jan Hendricks, I know she could not connect. Okay,
yeah, so everyone smile. Let's have a smile, and I'll say 1, 2, 3, and we go, okay? And smile, please. 1, 2, 3, and I'll take one more. Thank you. Let's see, we all have our eyes open and we can, it's somewhere when you want to talk about it, it'll be fun to say all these people, they've been there, at least the first day. So that's from my side. Congratulations, Shala, and thanks to everyone for being a part of this dream. And I think we can all say a part of our dream together.
Thank you so much.
Lovely.
Liz, if you could put the email ID in there, please, info.initiative. I would really appreciate that if you could send your ideas. You can directly call me also. I'm always there, you know that. And Janana knows I work like a... But let's talk about it. This is not supposed to be just the launch. It's just the beginning. I was so my partner Jan, I have to thank someone which was the most important one. That is my partner. So I got married again. Everyone knows. I don't think Dr. Chug knows, but Jan Carrot has been my partner in crime, my support system, and he's been my strength. So it's so amazing to have someone. And today, as I honor Puneet, I would also say that Jan understands and he appreciates, and that's what makes it very special, because he knows that Puneet would always be special to me. That doesn't change. And I hope to be able to launch and have a physical meeting as suggested by Raman on 21st of April. That's Puneet's birthday. And that time I would be in India. So we'll plan for a meeting together. So that's what we would do. That's what we do. So thank you so much. Thanks a lot. Thanks a lot for being here.